Welcome to the trauma assessment tutorial. In this tutorial, we'll be going over steps you need to take when you're going through your trauma assessment, especially for practical testing to be successful. Remember, in this station, you're mainly doing the assessment. Most of your interventions or things to treatments will be verbalized. You can also have as many basically imaginary EMTs as you need. Remember, when you start out, you'll get a scenario, so, something like a gunshot wound, a fall, motor vehicle accident, something of that nature. And then you'll be allowed to start the scenario. Remember, when you come in, before you even touch the patient, there's several things that you want to get out of the way. Scene safety, BSI, clear those two. Then you want to make sure and confirm this is your only patient. You want to restate the mechanism of injury, which is going to be dependent on the scenario, such as trauma, gunshot wound, whatever it may be. You want to consider requesting help early. If it looks to be a serious patient, you can request ALS to get them on the road. And then you want to consider stabilization of the spine. In most cases, if it's a serious patient, serious mechanism of injury, you'll want to go ahead and take C-spine. When you come in, at that point, you'll take C-spine yourself. You'll state the general impression of the patient, which if my patient appears to be unconscious or have any serious injuries, my general impression is going to be poor because they look to be a serious patient. There's two things you can do here. You can either go ahead and turn C-spine over to your imaginary assistant. Just make sure you don't let go until the evaluator confirms that they've taken over. I'm a fan of coming in, since you're already here at the head, and taking C-spine yourself. You can go ahead and assess the level of consciousness. Hey, bud, can you hear me? Can you hear me? Are you hurting anywhere? And my evaluator, in this case, my pretend evaluator says no response. So I'm going to go ahead and do a modified jaw thrust and open the airway, see if I've got any issues with my airway. I like doing this myself because being that I'm here at the head, holding C-spine, I can already take care of checking the airway and assessing the level of consciousness. My evaluator now advises me that I've got gurgling, snoring sounds coming from the airway. I hear gurgling, so I know I need to suction. At this time, I would turn my C-spine control over to another EMT assistant. They confirm that it's taken, I can let go. Now I can take care of the airway. My treatment is to suction the airway. That clears it. The other things I want to consider for airway are an adjunct at this time. They advised that my patient was unconscious, so I'm going to go ahead and insert an oral airway. They say that patient has no gag reflex, so oral airway stays in. At this time, I've taken care of airway. I want to move on to breathing. I want to know, one, is my patient breathing, and are they breathing adequate to sustain life? Because I have to decide, am I just going to put them on oxygen, or do I need to bag them with oxygen? They advise that my patient is breathing and it is adequate at this time. So I'm going to move on to placing my patient, having an EMT assistant, place my patient on 15 liters oxygen, non-rebreather. Next thing I need to do is expose the chest to check for injuries that might compromise breathing. In this case, my scenario was a gunshot wound. They advised that, and I notice I've got basically what appears to be a penetration or a hole here that has frothy red blood around it. That tells me it's a sucking chest wound. So the way I fix that is I'm going to get another EMT to apply an occlusive dressing taped on 3 sides. I want to assess to see if I've got equal chest rise and fall. They advise that it is. I don't see any other injuries that I need to fix at this time. So I've pretty much taken care of breathing. Now I can move on to circulation. I want to know, one, does my patient have a pulse? Check it at the carotid. If they've got a carotid, I want to know if they've got a radial pulse. If they have a carotid but don't have a radial, I know that their blood pressure is low and they might be going into shock. Also want to assess skin color and temperature. And I also want to do a body sweep for blood, looking for major bleeds. And they advise me I've got a blood soaking through the pants. I would expose it. They advise me I've got a major bleed. I would immediately do direct pressure with a gloved hand. I would request to turn that over to another EMT who would apply direct pressure and apply a pressure bandage. And my evaluator advises that that takes care of that. So I've taken care of airway, breathing, circulation, looking for life threats, taken care of a major bleed, taken care of a gunshot wound, open chest wound with an occlusive dressing. Now, I pretty much know they also advised that my skin color and temperature was pale and cool, and I had a very weak thready radial pulse. So I know my patient's going into shock, so I want to state that this is a priority patient. We want to load and go. We're going to treat for shock. We've got them on oxygen, we've got them lined supine, and we would want to cover them up to conserve body heat, because that's what I can do as a BLS provider to treat for shock. I called for the backboard to come because we're going to do a rapid transport. We're also going to apply a C-collar so we can put them on the backboard. Before I do that, I quickly want to check for tracheal deviation, JVD, or step off behind the neck. They advised that I don't have any of those, so we would apply the C-collar. Once the backboard arrives on the EMT that's holding C-spine's count of 3, we would roll the patient and expose their back, checking for any wounds or injuries that I would need to fix back there or major bleeds. I don't note any, so we would roll them back on the backboard at that time, load and go. I would, real quick before I leave the scene, want to check for a sample history. My patient's unconscious, so I can't get it from him. I would look for medic alert bracelets or jewelry. I don't see any, but I would try to ask bystanders if they have any information as far as sample. I've got my signs and symptoms already. I would want to know allergies, medications, last oral intake, and the events leading up to, which in this case was a domestic dispute and someone pulled out a gun and shot him in the chest. All right, at that time, I would want to get my vital signs. Remember, in the scenario, you're going to have a live patient. You actually have to take the vital signs. At the state test, you can't wear a watch anymore. They'll have a clock in the room with a second hand. So I would physically, for about 30 seconds, take the pulse rate, multiply it by 2. Just to speed things up, I'm going to say that I take the pulse rate and I get a pulse rate overall of 72. I report that to the evaluator. He reports that the actual pulse is 120. I would actually take a blood pressure on my patient, my live patient, for the testing. I'll just simulate that real quick. Okay, for this scenario, I'm sorry, for this patient, I'm going to say I got a blood pressure of 130/80. They report that for the scenario, it's actually 80/60. Once again, confirming that the patient is hypotensive and going into shock. Already doing all the treatments I can do for that. My other vital signs, I can check pupils. And I report that they're equal and reactive on this live patient. They report that they're actually sluggish for the scenario. Skin color and temperature, once again, and I can also do lung sounds and respiratory rate. Once again, respiratory rate, count respirations for 30 seconds multiplied by 2. Speed things up for this, I would say my patient's breathing 16 times a minute. For the scenario, they're breathing about 22. Quickly listen to lung sounds. Upper chest, lower chest. I advise clear and equal lung sounds. They advise for the scenario they're a little diminished on the side of the gunshot wound, but they are present. All right, so at this time, we've loaded into the ambulance. We're on the way to the hospital. I'm gonna complete my secondary survey in the back of the ambulance, which is where we are now. I'm gonna come, start at the scalp, checking for any contusions, abrasions, major bleeds, depressions. Don't note anything there. Once again, if I haven't already done so, I can check pupils as I pass over them. I can check the ears to see if there's any bleeding coming from the ears, also any bruising behind the ears or around the eyes. Check the nose and mouth for fluids, recheck to make sure my oral airway and my non-rebreather are holding up. I've already got the C-collar on, so I've already checked the neck, checked my shoulders. Now I'm back down to the chest. Once again, checking for equal chest rise and fall, check to make sure my occlusive dressing is still holding up. If I didn't do lung sounds and the vital signs, I would make sure I do them here. Come down to my abdomen, do all 4 quadrants, checking for rigidity or anything out of the ordinary, tenderness. They advise that's okay. Come down to the pelvis, Going to check stability by pushing in and pushing out. Come down each leg, checking for stability or major bleeds. Remember, I had a major bleed here. Make sure that it's still controlled. As I come to the end of each extremity, whether they're conscious or not, I want to ask, can you feel this? Can you move your foot? And check pulse. Same thing over here. Check pulse. Can you move your foot? Can you feel that? Check PMS at the end of each extremity. Remember, I've already checked the back when we log rolled them onto the backboard. If I hadn't done so, I would want to do that now. Now I've got my arms, same thing, checking for stability, major bleeds, anything on each arm. At the end of each arm, check for a pulse. Can you feel that? Can you squeeze my hand? Checking for stability, checking for pulse, movement. Can you move your fingers? And sensation. Can you feel that? Okay. Once I complete my secondary assessment and I'm comfortable with what I've done all the treatments I could do as far as the gunshot wound, the sucking chest wound, the major bleed. We've got them on oxygen. We're treating for shock. At this time, I would verbalize I'd want to do a reassessment. This is an unstable patient, so we would want to do reassessments at least every 5 minutes. So I would ask for another set of vitals. At this point during testing, you don't have to physically take them, you just ask for them. So I would want to know blood pressure, pulse, and respirations at a minimum. At that point, hopefully we're within the 10-minute time limit for this scenario, and we would wrap it up.